the Cana Ask the Experts series. My name is Mark Matthews. I am the Environmental Advisor to the Cana Board of Directors and a past president. Like many of you, I've been involved in local and statewide conversations on disaster preparedness, and I'm eager to learn from today's presenter, folks that have been there at the first cremation of an Ebola case. Before we get into this program, I have a couple of housekeeping items I want to share with you. Due to the size of the webinar today and the attendance, every attendee has been muted. Please submit your questions via the chat function in the webinar browser. Questions may be submitted throughout the webinar, but will be addressed at the end of the presentation. We may group similar questions together in order to answer as many as possible. This webinar will be recorded, and content, including your questions and answers, may be used in future Cana programming. Just like probably you as a practitioner, with the Ebola issue in the United States, I've kept an eye on the impact of it in our profession. Cana has, from the beginning, said that this disease would be limited and contained, and so far, gladly, that's the case. But we have two gentlemen that participated in the first cremation and removal in the case of a death in Dallas, Texas. So it's my pleasure to introduce both Scott Smith and David Patterson. David Patterson is the CEO of Global Mortuary Affairs. David, welcome.
Thank you very much. I want to start off by saying that what we're going to share with you today are the experiences that we actually had in the field, and that's the baseline of what we're going to deal with. We're going to talk about a little bit about Ebola, how we got involved, planning, implementation, and then the removals, and then we'll go into lessons learned and then questions at the end. Some abbreviations that we'll be using today are in front of you. The ones we're going to be using the most are the Texas Department of State Health Services, the CDC, and then the Texas Funeral Directors Association, along with the National Funeral Directors Association. And then anytime that you see the word attending, it's going to refer to the physician that assisted us in the removal. The mortuary will refer to Global Mortuary, and the crematory will be Heritage Crematory Service. A little bit about myself. I was licensed in '87. I've been a member of the Disaster Mortuary Operational Response Team since '99, and I have been a member of the Texas Funeral Directors Association Disaster since 2000. I sat on the State Preparedness Coordinating Council. I also sat on the State Mass Fatality Steering Committee, and I serve as a liaison between the Texas Funeral Directors Association and the State of Texas Department of State Health Services. I was asked to give my opinion and my views on the Ebola work group through the CDC and NIOSH just recently.
Hello, my name is Scott Smith, and I owner and president of Heritage Cremation Service and Cremation Alliance of Texas here in Dallas. Been licensed since 1993, crematory operator license in 2007. I'm a member of the Texas Funeral Service Commissioners, currently serving as commissioner there, along with David on the Texas Funeral Directors Disaster Team, and some past offices that I've held in the Dallas, North Texas, and state level for the funeral service.
Just as a historical view, Ebola, as we discovered, was found in 1976, and it affected 284 people with mortality rate of 53%. The second Ebola outbreak infected 318 people, and mortality rate was 88%, which was the highest that was recorded at the time. The third strain was found in '89, and then the last strain was discovered in 1994. So that's just kind of a historic look. This seminar that we're doing today is going to focus on the Dallas death, which was confirmed as September 30th of this year. It was the first laboratory confirmed case of Ebola. The patient did not have symptoms when leaving West Africa, but developed them approximately 4 days after arriving in the U.S. He sought medical care, and based on his travel history, He was had the medical facility isolated the patient and sent the specimen for testing at the CDC as well as a Texas laboratory. And the local public health officials identified all the close contacts for the patient over the past for the 21-day period. And unfortunately, he died October 8th and was cremated the same day. This is just a slide showing how the tracking method works with the CDC, and it's a very interesting slide of how they do that. And I want to take this opportunity to point out that the CDC took a huge beating in this. And my personal feeling with my contact with them and the guidelines that were set forth, I think they did a superb job of getting this under control and keeping it under control. And I think they've done a wonderful job. Now with planning, working with the State Department and Centers for Disease Control, we were contacted, the mortuary was contacted by Texas Department of State Health Service on the 2nd of October, and they requested us to put some input on the protocols to be used in the event the patient died. We reviewed the CDC guidelines with Dr. Lakey, and at that point, the state requested that we supply the material and services in case the patient did expire. Texas modified the CDC guidelines just slightly and added BioSeal to it just for a safety standard. But in general, the body should have been double bagged as hospital protocols, not moved to the morgue, all containment to be completed in the room, use a self-sealing body bag as a secondary precaution, and then BioSeal as to transport the patient. The question was asked, is BioSeal overkill? And I personally agreed that with all of the rest of the material, the 2 body bags, the self-sealing bag, which meets or exceeds the OSHA bloodborne pathogen guidelines, that BioSeal was an overkill. And we agreed that we would drop that from the guidelines that were set up. We had no contact through the CDC. All the information has been passed through Texas Department of State Health Services, and then shortly after that through the Dallas County Medical Examiner. Both of those entities agreed to waive all laws, rules, and regulations due to the public health issues of this disease. Dallas County Medical Examiner wanted to ensure that if the death happened at night, that the mortuary would do the removal and the crematory would do the cremation without delay. And we all agreed on that. They provided letters in writing suspending all laws and rules for that. We worked on that between October 2nd and the 8th, which was the date of death. There were some provisions that had to be met to provide the removal service without delay, proper materials to contain the deceased with no leaking, and the cremation service would be done immediately. Those were the big things that they wanted to ensure. They also suspended the vital statistic rules just for this case to make sure that this was done straight away. All conversations were still directed through the Texas Department of State Health Service and Dallas County Medical Examiner at this point in time, using the guidelines and protocols set forth by the CDC. And on October 8th at 7:51 a.m., the patient died, or at 7:51 a.m., the patient died, and the mortuary received a call from Department of State Health Service at 8, requested us to be at the hospital at 9 o'clock, prepared to make the removal. At 8 o'clock, when we got the call, we notified the crematory at 8:15. They were directed by the Texas Department of State Health Service to not start any new cremations, and they were to wait until this patient arrived and do the cremation immediately. At 9 o'clock, while we were at the hospital, the CDC called and wanted to review their protocols, and they pointed out that we needed to have a metal sealing casket. And at that point, I pointed out that during Hurricane Katrina and Rita, all the caskets that we recovered from the cemetery had water, mud inside them, and they asked what we had intended to use. And at that point in time, I described BioSeal as a level 3 containment. It has 6 layers, one of which is metal that can be heat sealed, which allows it to be hermetically sealed in the patient's room and no further chance of infecting once the remains were in the BioSeal. The CDC agreed verbally to allow BioSeal to be the containment system. We happened to bring it with us just in case to make sure that didn't happen. There was a delay. We were not taken to the floor until 11:30. And some of the delays are mentioned here that the press was notified prior to the family, and the hospital had not placed the remains in the pouches as per their normal standard protocol. Once we were escorted to the floor, we were told to wait. The body still wasn't ready for release. At 12:45, we began to question what the actual issue was, and we were told that the staff was not wanting to volunteer to go back in to the isolation room to provide the standard mortuary care. And we volunteered to go back in, or to go in, and the attending physician that was there agreed to go with us, along with another gentleman that worked for the hospital. And the attending physician asked us what the protocol was after the initial bagging. And once we went over that, we had the chance to practice it. We had the chance to work out the kinks before we went into the room. And then we entered the room. There's a slide that's coming up called Special Precaution, which I'll outline the protocols, steps that we took during the removal process.
Although there were no specific guidelines in place from the CDC for the actual cremation facility for acceptance of the body, we followed our normal procedures for accepting the body, with the exception of the identification process. The body was in a level 3 containment bag, so we felt that there was little to no risk of spreading of the virus at the crematory. We kept the everything, we kept everyone in the full personal protection that they needed for this, as they would for any type of person that had a high level or high risk. But we followed that as closely as we could with what our normal procedures.
The special protocols that we used, the hospital provided the mortuary with all of the personal protective equipment, and that included scrubs, several pair of booties, a full hood, Tyvek uniform, and Pappers, and several pairs of gloves. So we were protected from head to toe during the removal. Once we got into the room, the attending and the mortuary disconnected all the IV lines from the machines, not the remains. We took them off the machines, laid them on the middle of the patient's bed where they didn't cause any interference. We pulled the bottom sheet off the bed, wrapped it from side to side, then covered his head and feet to make sure that he was completely covered. And at that point in time, we did a regular hospital roll, placed the body bag underneath the body, and then secured the body bag and zipped it closed. At that point in time, we disinfected our hands, the body bag, the hospital bed, and the outside of the body bag. We rolled the mortuary stretcher up next to the bed. On top of the mortuary stretcher, we had BioSeal on the bottom. Then we laid a total control bag on top of that. And then we placed the remains into the total control bag and sealed it completely up. And total control bag is a bag that has a special formula adhesive on it, and when you stick it together, it seals and it does not leak. Once we had the body into the total control bag, we disinfected the body bag, the hospital bed, the mortuary stretcher, and then our hands again. And we were using bleach wipes and a hospital spray. And I do not know what the hospital spray was, but I'm assuming that it was a spray that they had been passed. Once we did the disinfection, the BioSeal, we closed the BioSeal flap and began to heat seal it. And in heat sealing BioSeal, there's a thermal sealer that heats up, and you compress it onto the two layers of BioSeal, and it forms a seam that you can actually see and welds two pieces of aluminum that are impregnated between there together, causing a seal that does not leak. And once we were finished sealing it, the attending physician asked if we should double seal it. And at that time, we decided to go ahead and double seal it just to where he felt comfortable. We disinfected again. We disinfected the mortuary stretcher, the BioSeal material. We actually rolled the remains to where we could disinfect underneath it, disinfected the top, the stretchers, the thermal sealer, and our hands. And the remains then stayed in the room while we doffed our personal protective equipment and showered. And an employee of the hospital brought the remains on the stretcher out to the cold zone and ready for us to make. The hospital, upon us leaving, required that we wear gown, gloves, and masks to remove the remains down to our vehicle. And once we got to the crematory, we used standard personal protective equipment, gloves, masks, and we also had aprons on as well. We placed the remains into a alternative cremation container or a cardboard container, and the remains went directly to the retort for cremation, and all our personal protective equipment that was being used was cremated with the remains. Once we got back to the mortuary, we donned gloves, disinfected the removable vehicle with bleach wipes. We used it on the vehicle, the stretcher, the thermal sealer, and then we used mortuary sanitizing spray on the same things to ensure that we had a good disinfection. This photograph is not of cremains. It is a slide that I developed just to show you what the BioSeal looked like with cremated remains in it. The Texas Department of State Health Service did ask us to BioSeal the cremains, even though they publicly stated that the cremation process would kill the virus. The State Health Department had gone over and above on all the other protocols, and they wanted to ensure that this protocol was over and above as well. Dr. Lakey had said that the cremation process will kill any virus in the body, so the remains can be returned to the family with no need of protection. But again, they just wanted to make sure in this case, since it was the first one, that there was no risk whatsoever to the family or any of the rest of the public that might come in contact with cremated. Some unexpected obstacles that we had at the hospital was communication. Texas Department of State Health Service and the hospital agreed that they would do standard mortuary care. They placed remains in a shroud, put shrouded remains in a body bag, and the delay that we encountered was due to the hospital not performing that function. Again, we asked what we could do to help. We volunteered. The wonderful thing about this, even though it was an unexpected obstacle, and even though that it took some huge amount of time, 6 hours total, what it allowed us to do was to incorporate the standard practice at the hospital into the CDC guidelines for the removal in a very seamless transition. Instead of having two different teams working on the process, it allowed us to complete the entire process with only 3 people involved instead of 2 teams do so. So even though it was an unexpected obstacle, it turned out to probably be one of the most beneficial to the mortuary team, at least, that happened. The press was notified prior to the family, and they were also notified prior to the mortuary completing the removal. We were told originally that the press would not be notified until we had made the removal and were well on the way. And I guess the biggest obstacle that we had was the delay at the hospital caused the crematory to shut down for a complete day. The delays and the mandates that the state put on the crematory just would not allow them to do any of their normal business.
Some unexpected obstacles at the crematory, as David had mentioned, the multiple bags that the body was placed in and then encased in the bioseal bag made the entire remains in a larger and too big to fit in a standard size alternative container. So we had to, at the last minute, once we realized that once we received the body, we had use an oversized alternative container to place the deceased in. An air tray or combo unit would work well in this area. As he mentioned earlier, we were mandated for the crematory upon receiving of the remains not to have non-crematory personnel there or any public, any other funeral homes coming in and out. So we did have to, shut the crematory down basically during this time. Even though this was not mandated by the CDC or Texas Health on any processes during the cremation, we chose not to open the retort for repositioning the body as we normally would do. We just erred on the side of caution not to open once we began that process.
One of the other things was the aftermath of the removal. The mortuary personnel was placed on self-monitoring October 18th. With that said, the state and the county knew that the mortuary was going to be going to the national convention and cleared the mortuary personnel to go. When we were headed back into Texas on that Friday, the 18th, we got a call from the U.S. Department of Public Health Services, which is the overarching agency for DMORT, and they wanted to check to make sure that their personnel were being looked after since we made the removal. And at that point, we were placed on the monitoring list, and I'm glad to say that the 11 days seemed like forever, but it was well that they wanted to trace everybody, even though our exposure was very, very limited. Since the removal, the CDC has contacted the mortuary. to review our actual field experience. They asked us if we had a paper that was available to them, and we sent that to them. We also had a conversation about the products that we used during this removal, as well as the protocols we use, and they asked for us to share our experience with the Ebola work group, which we were more than happy to comply with. The state of Texas has interviewed us as well as to document the removal process and to improve the protocol for the next patient. I know that the CDC is working as well as to improve protocol, and I really feel as if the next patient will have a whole lot better guidelines to go by. When I say better, I don't mean better. I mean clearer guidelines to go with as far as the process and then the removal. But in the process of all of this, several states talked to myself as well as the crematory side about documentation on the removal process, cremation process, for their best practices. Several of the local medical examiners here in Texas have called to find out what if any of our availability would be, the PPE that we use, the bioseal training, and where the material was located.
I think, as you can see in this, hearing from David and seeing the slide, that this is a two-part. This is a containment and removal, and then you have the cremation process. And I think it's vital that the containment and removal part be handled properly for crematories that are receiving remains potentially with Ebola. I talked to the CDC about the recovery of remains, asking if there was any potential risk for anything surviving that, and they have documentation from them that there's no way that the Ebola virus can survive through a 1600-degree cremation. So even with that said, we still use, as I said earlier, the universal precaution for processing and packaging, and throughout the whole time, we always maintain that to potentially from any problem. We did, as the Department of Health Services requested, we did bioseal the cremated remains, and as they were being returned to the family. The receiving of remains cremation went smoothly. It was, for what I said earlier, a very good job was done in the containment and the removal and transportation to the crematory. So we knew when the body was received that the risk was pretty low on our end. Even though we maintained a high level of precaution, we felt like in the containment bag that it was in, that all the steps and protocols had been followed, that we were at a pretty low level of risk. We were told from the very start, under no circumstance, once the body was received by the crematory, for the containment bag to be open for any reason, for identification, for anything. So we obviously followed that, and immediately upon arrival from at the crematory, it immediately went into the retort, and the cremation process began immediately. As I said, the containment bag should not be open for any reason. Identification must take place at the medical facility or place of death. And with any type of communicable disease death, much less on the level of Ebola, the highest level of precaution. Never take for granted the containment system. Always use precaution, and that's what we did. We knew that from the very start. One thing I'll add to this as well, there's been a lot of question about pacemakers, defibrillators, any type of mechanical or battery device that would be attached to someone, and been a lot of conversation with State Health Services and CDC on their guidelines on this. And I think that at the end of the day, what has been decided on this, what I think would be best is that if there's a higher risk of contamination by opening the bag or trying to remove that, then there would be to leave that on the person and let it go through the cremation process.
Some of the lessons that we learned on the mortuary side is that CDC is responsible for working in tandem. They provide guidance. They refine protocols for healthcare workers and mortuary workers, which they are in the process of doing now. And it's the state and local jurisdictions that actually have to implement the plans. And again, I can't say it enough that the CDC took a horrible beating in this, and I just don't think it deserved as the general public might think. Texas Healthcare Presbyterian took a beating as well, and I think their protocols were in place, and I think that between the CDC, the health department, and the hospital is using their protocols is the reason we don't have any more Ebola outbreaks than what we had. We had 2 out of who knows how many people were actually involved in the health care of this patient, and only 2 nurses got Ebola, and that's too many. However, I think that the guidelines worked, and now that they're being improved, I think that will cut the number down even further. The main thing is you have to stay calm in these situations. If the people that are making the removal have never wore full personal protective equipment, the time to start learning to wear it is not when you need to be making an Ebola removal. You need to practice beforehand with the material. They're very restrictive. They cause claustrophobia if you're not careful, and they're just cumbersome to work in if you've never worked in them before. So if you wait until the time that this happens, it's too late. And the other thing that I want to point out is you have to know the material you're working with. You have to have a level of faith and trust in it, and you have to know how to operate it correctly in order to make this work smoothly as it did. One of the questions that we were asked about using BioSeal is, does it expand or contract with atmosphere or with pushing on it, and what about the air that's trapped in it? And the overarching answer to that question is, as you're sealing the BioSeal, you can push the air out as you're sealing down the sides of it, and it'll escape the air, which will make the package a little bit smaller, not quite so cumbersome for the crematory. So knowing all of this information is really important on the front side. The type of gear that we were in, now these are not the exact gear, but it is the type of gear, and it did show the hospital papers, which a lot of funeral directors have never seen before, which is why I chose this particular picture. It is, in general, the type of protective equipment that you need to have on. Full face respirators are acceptable as long as you have a face mask that are covering your eyes as well. But you need to remember that if you're going to wear a full face respirator, there are OSHA guidelines as to fit testing and breathing fitness before you put somebody in one of those. And you can find the answers to those questions and the guidelines in the formaldehyde standard, which is a CFR 1910-1040 in the appendix. These are the type of suits that were worn. They're available from the chemical companies as well as general suppliers. This is the biocell system. That the photograph that you're seeing shows a 100-foot roll, which will accommodate 15 remains, as well as the thermal sealer that's used. It is level 3 containment system. It's used all across the country by medical examiners, law enforcement, funeral professionals, airlines, and it is, in the funeral business, the only truly hermetically sealed system that is available on today's market. And by definition, hermetically sealed has the quality of being airtight. You might say that it implies that it's impervious to gases, which is why if you use BioSeal on a decomposing body, that you can put it in the front of a funeral chapel and nobody will know that it's there, because it doesn't let the smells out when sealed. This is the TC bag, or the self-sealing bag. It's translucent. It has a adhesive formula on it that sticks to nothing but itself. I think of it kind of like cling wrap, that it sticks together and it pulls apart and open and close it. It seals from side to side the length of the bag. Then the ends either roll or fold in and seal on top of itself. And the picture that's depicted there, the top one, you can see that it is kind of rolled to the top and stuck. And on the bottom, you can see where the rolling it up is how that was done. If there's any questions or anything at this time, we're prepared to.
I have some questions here, David and Scott. Thank you very, very much for your presentation. And those of you who are attending, if you have additional questions, feel free to enter them in, and they're being forwarded to us. But let's start with one question that came in that I hadn't heard asked is, was there any fallout in the community where the cremation took place? During this process, the company in Dallas that handled the burning or the incineration of the medical waste got quite a bit of press, but it seems that you escaped that. Do you have any comment on that?
Well, it was not publicized here in Dallas or anywhere about the cremation. That I did the cremation, and we did not publicize it obviously ourselves. So it was not the plan was set forth for when deceased was removed from the hospital and brought to the crematory, that was all to be done prior to a release of the notification of death. So without the publication of that, no one really knew who did that.
And the other thing that I might add to that is when Texas Department of State Health Service contracted with us for services rendered, I never disclosed the name of the crematory that we were going to. And that was kept completely under wraps for that very purpose.
Good, thank you very much. We've had some operators, especially that might have a crematory in their funeral home, suggest that might not be the best thing for the community. You had also done a second question, is you said that BioSeal might have been overkill in the beginning of the presentation, but given what you know today, would you use that again?
Absolutely. If I had to change anything, BioSeal would be the frontline defense. And whether you put BioSeal on the outside or on the inside of a body bag, it doesn't matter. BioSeal does not have handles, therefore it is a little bit cumbersome to handle. But I think BioSeal is necessary for containment.
Okay, great, thank you. Another question, which is a good one, is did you have any direct contact with the family, or did you deal directly with the agencies that you mentioned? And along those lines, did you then have contact with the family at the release of the cremated remains?
The Answer is no. To this day, we've never spoke to the family. On the front side of this, Judge Clay Jenkins' office dealt with the family. State dealt with Judge Jenkins' office, and the state directed us. The release of the cremains were released to the Dallas County health official, and him and Judge Jenkins took the cremains to the family. All of the signatures and everything that we got after the fact from the family all came through Judge Jenkins' office.
Good, good. Thank you very much. You mentioned that you asked your respective staff for volunteers. Tell us how that worked and how it went.
On my staff at the mortuary, I asked for a volunteer to go with me to make the removal. I had absolutely no issue with people volunteering. However, once we got to the hospital and we found that there was going to be all of the personal protective equipment involved, I elected to not allow my employee to go in. He had never been in any situation where he's had to wear the full personal protective equipment, and I did not feel comfortable in trying to train him on this particular case. So that's the reason why I did that myself. Through some associations I've had with the Disaster Mortuary Operation Response Team and with the Texas Funeral Directors Disaster Team, I had prior training to that and felt very comfortable in doing it myself.
So you did the work in the room by yourself?
No, it was myself, the attending physician, and then a hospital employee that volunteered.
Okay, great. There's been you've been involved in DMORT deeply, and why don't you expand a little bit for everyone's benefit on kind of the two-person protocol of putting on PPE and and perhaps more importantly, removing it. And then, if you will, you mentioned a little bit about claustrophobia, breathing, and things like that. There's also, it's warm in those suits.
It absolutely does. To start with, the actual, when we donned the protective gear, we got completely out of our street clothes and into hospital scrubs. At that point, we put on a pair of booties and then used when I say booties, I'm talking about the type of shoe covers that go completely up to your knee. And then we put on a second pair and 2 pair of gloves, and then walked into the warm zone and donned the Tyvek suit. At that time, they put the hospital pappers on to keep the cool air blowing in while we were working, and hooded us, and then put on an additional pair of outside gloves, and then an additional pair of the booties as well. Once all of that was on, they taped the zippers, and they taped around our neck to make sure that there wasn't any exposed skin, and then we went on into the room and removal. And when we came out, we did just the opposite. We took off our hood, our booties, and then our outside gloves. And then with a pair of clean gloves, we took off of our Tyvek suit, and then cleaned our gloves again, and then took off that pair of gloves, which left us in 2 pair of booties, one of which we took off in the room, and then the clean pair we stepped out into the cold zone in scrubs, a pair of gloves, and booties, which we took off at that point in time because they were cleaned. And at that point, we went to a wash station and washed our hands, our arms, face, any exposed skin, and then went to the shower and showered, and then got back into our street clothes. The claustrophobia feeling, mainly, get very hot in those suits. They're very sweaty, even with the PAPRs running. That just kind of cools around your head area. But the glass or the plastic face shield that's in front of you tends to make the world look a little bit lopsided looking through it, and it restricts your vision side to side without turning your entire body. So with the heat building and the kind of fishbowl effect that face mask has tends to disorient people. They're not used to that sort of stuff. And even if you are used to it, I hadn't put a set of full personal protection equipment on probably in 8 months or better. And even when you get it on to start with, it takes you a few seconds to reacclimate yourself and then get back into doing what you're doing. So that's the reason why I strongly stress that, if a funeral home gets a call to do this, it's better to have somebody that knows how to put the stuff on, how to take the stuff off. But just being in it and comfortable in it is very, very important.
There's a lot of questions about this process, and so I want to continue on the PPE. But first of all, can you elaborate just a little bit on when you were contacted and the time frame you had, and what would you advise someone, another operator or funeral director, that were contacted by either their state or county Department of Public Health and said, we have an Ebola death pending? What kind of warning did you have?
We actually received the first phone call from the Texas Department of State Health Services on the 2nd of October, which was 6 days prior to the death. And so we had almost a week to prepare. We went ahead and cut our bioseal to 7-foot length. We rolled it up, got all of our removal supplies together in a container that if we would have lost the container because of contamination, it wouldn't have mattered. And we spent most of that time, though, ensuring that the paperwork was going to be in order. The letter from the health department suspending the rules, the letter from the ME's office granting us permission to do the cremation without the proper documentation, the vital statistics for understanding there's going to be a delayed factor filing a death certificate. So a lot of that time was spent administratively just getting all of our permits in order, getting all of our letters in order, and getting all of our people prepared for what turns out to be the eventual death. As far as what I would tell somebody that was called on to possibly do this is, number one, find out, are they going to suspend the rules? Are they going to provide personal protective equipment, or do you need to provide it? The hospital provided all the protective equipment for us when we made the removal. And I would think in a hospital setting that would be what's going to happen. But spend a lot of time, build a very good paper trail of whom you talked to, what they said, and what the final outcome is supposed to be. We had a call from, and this was, the cremator returned to my office on the 9th of October, the day after the death. The cremains were picked up like the 11th by the health officials. And we got a call after the 11th from the district attorney's office, making sure that all of the paperwork they had, that we had, and all of the communication that they had, we had to complete the file. So even after the fact, we spent another probably 2 days just working, passing back and forth. You have this document, and ensuring each of us had a complete set of documents. We printed off all of our emails, put them in the file. So if anything was to ever come back, we have everything that we did documented.
Thank you. To just continue the process, so you've now changed into street clothes, and tell us about the transportation from the hospital to the crematory. Was there any kind of escort? Did you wear any special clothing, or what happened?
We wore gowns, face mask, and shoe covers and gloves out of the hospital to the removal vehicle. And I might note that for the mortuary people that are on this webinar, we disinfected the mortuary cot so much, and to the point where we removed the grease from the slides, which allows the cot to collapse, and it did not want to work properly once it got down to the car because of the amount of grease that we'd removed on it. But we had 2 Dallas County Sheriff's Departments standing by with us. They followed the car to the crematory. Once we got to the crematory, the remains were unloaded. They left. The car did not have special markings on it, and I believe that's probably why we had an escort in case there was a wreck. They knew what was on board. As far as cleaning the vehicle out, once we got back to the mortuary, we pulled the stretcher out. We disinfected the entire inside of the car with bleach wipes, mortuary spray, and then used just a masking material to cover the smell of bleach because it was so strong. But that's kind of the procedures we used on that.
There are a number of questions on the bleach or the disinfectant you used, including the dilution or the level. It sounds like you juiced it up pretty good. Do you want to talk about that briefly?
When we got into the isolation room, there were towels being laid on the floor, and the hospital worker that went in with us was pouring straight bleach on the towels on the floor. We were actually standing on bleach towels, and there was no dilution. I don't know what the spray that we used at the hospital, so I don't know what the dilution is on that, but the bleach wipes were the bleach wipes that you buy out of a regular store, and I believe probably by the time we left out of there, we had 2 full containers to disinfect ourselves and the equipment that we were using.
Okay, now that we're at the crematory, a common question is, there's a handful of questions. One is the length of the process from beginning to end on cremation. If you want to comment on the manufacture of the equipment, and then, you know, would you recommend anybody do this, or would, you know, describe your equipment? Was it a hot hearth? Would you recommend an old crematory, a new crematory, or a hot crematory, or a cold crematory? And we're getting tight on time, so let's give that a couple of minutes, and then we're getting close to wrapping up our hour here.
Okay. Upon receiving of the remains at the crematory, as I mentioned earlier, it was in the bioseal bag. We went immediately to the retort. The cremation process was not unlike any other than we did not reposition the body. The bioseal bag did not add any more time to the cremation. It was a very routine cremation once the cremation process started. The unit that I did the cremation in was a relatively new unit, and it is a hot hearth, so I can't really speak one versus the other. I just know what I used, and it was very routine in form of the cremation.
Was there any post-cremation testing done or at the crematory?
No, there was not.
Okay. And the temperature was typical of any cremation that would take place?
Yes, it was just normal, about a 1,500-degree temperature in that area. It was just a normal cremation once the process started.
Great, great. We're about to wrap up, and before I do so, first of all, I want to thank you for everyone for participating. There are still a number of questions that haven't been answered, and we received a large volume of them. David and Scott have agreed to review and answer your questions offline, so look for an email in the next couple of weeks. Before we conclude, I also want to mention you're going to receive an email shortly with the links and a short evaluation. Please take a moment and provide feedback to your survey and any additional questions you have for David and Scott, and both Kana and they will follow up with you to the extent that we can. Before we leave, though, for your colleagues, David and Scott, you've done a great job here. Your professionalism is outstanding, and it's a real privilege to have you do what you did on behalf of Texas funeral directors and cremationists across the United States, and sharing that information. With that, I'm going to leave you for a second. Do you have any closing remarks you'd want to leave for the group?
As you heard in this webinar today, that the critical part of this is the containment and transportation. As a cremationist, it was vital. It was very critical for me and for my staff to receive this remains in a containment bag that the risk was very low. So as you've heard today, the bulk of this has been about the removal and the containment at the hospital. So what I would say to any cremationist out there, that if you are not the one making the removal, if it's not part of your funeral home, that you obviously are in on any planning prior to the death, that you can be able to know what to expect when the body is received at the crematory.
And I would add, from a mortuary point of view, that if you're called on to do this, instead of saying no to start with, look at what you have and the experiences that have taken place, and if you feel comfortable and you feel confident in the material, then this removal, although it may be a little longer than normal in cases, anyone can do this with the right material, is what I'm trying to say. And I encourage you, if you have any questions or anything like that, of what we did or why we did something, please feel free to contact us. And thank you for inviting us.
Well, I want to just echo the thank you for your participation in this program and sharing your hard-won knowledge that'll help the rest of us plan better in our businesses, in our communities, should we have to deal with a case that involves Ebola. But I would remind everyone that you're more likely to deal with a case that, whether it be tuberculosis or any other communicable disease, and this just is extremely, obviously much more difficult to handle. And again, the effort has been to not spread unnecessary fear, and as we've felt, this has been contained and limited, and hopefully stays that way. But the knowledge that you've learned today from these great professionals, you can take back to your business, whether it be any other disease or any other handling, and a great way to educate your employees. I want to thank you again for your time, and we look forward to seeing you all soon at another CANA program. Thank you very much.